Welcome back to Daybreak. Some hallucinations are normal, while others can be a sign of something more serious. So before we close the book on May and Mental Health Awareness Month, we wanted to talk to Baptist Health psychiatrist Dr. Kristina Kennedy about this. Thank you so much for joining us this morning.
Of course, good morning.
Yeah, I think when you hear the word hallucination, people automatically just listen. They want to know more about it because it is such an interesting topic. So tell us first of all, what are hallucinations?
Yeah, so we hear people talk about hallucinations all the time, and they can be a little bit taboo, but essentially hallucinations are just when you're perceiving something that's not really there.
Okay, and there's actually different types?
Yeah, so just like, I was saying, it's picking up on a sensation that's not really there. So all five senses you can have hallucinations with. So you can have visual hallucinations, auditory hallucinations. You can also have tactile, olfactory, and gustatory hallucinations. So you've got your sight, sound, your smell, your touch, and your taste. So everything can deceive you, essentially.
Right. So how do you tell that you're hallucinating? Can you even tell if you're doing that?
It depends. So not always. And sometimes, especially if you have a psychiatric problem and you're hallucinating, you may not be able to tell what's real or not. But you can use context clues in your environment. So certainly if you're sitting in a room by yourself, but you hear somebody talking to you, that's a good sign that maybe that's not real. Or if things just don't really make sense, you're smelling something that's not around, or you're tasting something you're not eating, or you're seeing something that just doesn't fit in that environment, then that's a good sign that maybe something's not right.
So if you experience any of these, do you need to automatically go to the doctor?
I would suggest talking to your doctor if you're having any hallucinations, just because sometimes they can be normal, but other times that they can indicate either a psychiatric problem or maybe some other type of medical issue, something neurological or something like wrong with your lab. So I would definitely recommend talking to your doctor about it.
Do you think it should be as, something of concern for people?
So I would say just start by talking to your doctor. So don't get freaked out if you feel like you're hallucinating. And if you know somebody that you think might be hallucinating, you see somebody talking to themselves, or you think a family member might be hallucinating, I wouldn't argue with that, but just encourage them to talk to their doctor.
Yeah, I'd imagine that would be a tough conversation to have with someone.
Exactly.
Yeah. Well, thank you so much for joining us this morning. What an interesting topic.
Of course.
And of course, if you want to get in touch with Baptist, you can go to their website or give them a call. That information is right there on your screen.